Hello everyone, I'm David and welcome back to another first aid skills video. In this week's video we're going to be going over some medications you might come across that help treat asthma, allergic reactions, and anaphylactic reactions. So first one we're going to look at is this one. So you may have seen it. This is an inhaler. So with an inhaler is used for the treatment of asthma. So with asthma, when you're dealing with someone with it, they might be having shortness of breath, tight chest, gasping for air, and they may have been prescribed one of these to help when they have those. So with asthma, you might come across this, which is a long-term treatment. This is what people take. They usually take it every day, and it kind of reduces the severity and amount of times they have reactions. So to use one of these, if they have it, they'll open it up like that, give this little tag a pull, they'll breathe out as much as they can in their mouth, breathe in as much as they can, hold their breath for as long as they can, but best would be about 10 seconds, and then breathe out, and when you're done, close it up. Now these ones, however, these are only taken if they're having a serious reaction and they need instant help. That's where these ones come in. So these are also referred to as rescue inhalers. So with a rescue inhaler, you take off the tip, again, have them breathe out as much as they can in their mouth, and as they breathe in, you want to hit this down, and when you hit it down, you just saw that it dispenses the medication. So they breathe out in their mouth and then in. As they hit it, hold their breath for 10 seconds and then breathe out. With these rescue inhalers, they might also come with it's like a tube kind of thing. It has the mouthpiece on the end. It's a longer tube, and that's called a spacer. So when working with a spacer, it's the same things. You want them to breathe out, put this in the tube, and then they'll be on the mouthpiece on the far side. And then you want to dispense the medication in and then have them breathe in. So you don't do it at the same time. You put it in so it mixes with the air, and then they breathe in, hold their breath, and that's how you use these two inhalers. Now for minor allergic reactions, people typically take a thing, antihistamine. So that's just little over-the-counter medications that people have in their houses for anything. So if there's like a minor rash or an itch, they'll take one of those medications, and that will generally get them over their symptoms of whatever that minor allergic reaction is. However, for a major one, which is more of an anaphylactic reaction, that's when they'll be prescribed one of these. So this is called an epipen. So the way an epipen works is this is only used for serious allergic reactions where they're having extreme difficulty breathing, rashes over their entire body. This is one of the ones, this one and this one are when we talked in our video 2 weeks ago. These are life-saving medications, so if they can't take it, but they do have it and they've expressed a need that they do need it, these are ones that we can give. This one is not life-saving, neither are antihistamines, so that would be one that they have to take themselves. So with an EpiPen, they're easy. Instructions are right there on the back. We want to pull the back off, which releases this, or makes it so this bottom part can actually inject. So we want to put this in a big muscle, so it's typically the thigh. So you grab it in your hand and you want to put it into the thigh. Now you want to hold it in the thigh for 5 to 10 seconds. Hold it there in the spot, and then once 5 to 10 seconds is over, pull it out. The needle that did come out of this hole is now covered by this orange piece that came out, so now it can't poke you or anything, so you don't have to worry about it. And then you want to massage the spot where it was injected for 30 seconds to help move the medication around the body. So for anybody that's experiencing symptoms that affect their breathing or rashes up around their neck area or that are progressively getting worse, these are times we want to call 911. Because if we give them this and it doesn't work, we want to have 911 on the way and not be scrambling for it once we realize that these medications aren't doing anything. Typically for minor reactions like rashes that you can take antihistamines for and get better, you don't typically need to call 911 for those. However, if they do start getting worse over time, it might be a good idea to have 911 called and on their way. So that's it for this video. That was our long-term inhalers. This was our rapid or rescue inhaler, and then our epipens. So thanks for tuning in for this week's video. I hope to see you all next week. Thank you. Bye.